This is a presentation on connective tissue, and the presentation is by Dr. K. Connective tissue is the most abundant and most widely distributed primary tissue. The features of connective tissue is that most of the cells are not in direct contact with each other. There is a lot of ground substance, unlike the epithelial tissue. Most of the connective tissue is vascular, whereas the epithelial tissue is avascular, which means it doesn't have a blood supply. So the connective tissue, even though it is vascular, the vascularity is very variable. The loose connective tissue is highly vascular, whereas cartilage, which is another type of connective tissue, is less vascular. Coming to the functions of connective tissue, it connects organs. So the tendons, which are connective tissue, tends to connect the muscles to the bone. The ligament connects bones to each other. They also have a supportive function. For example, the fat, which is adipose tissue, it's a type of connective tissue. It supports the eyeball in the eye socket. And also the bone, which is connective tissue, supports the body framework. So connective tissue provides physical protection of organs. For example, the cranium protects the brain, the rib and the sternum protects the heart and the lungs. Immune protection. The white blood cells, which is connective tissue, protects against foreign invaders. Connective tissue provides movement of the body. The bones provide movement. Also, it is a reservoir the bone is a reservoir for calcium and phosphorus, and fat is the main body's energy reserve. Another function is heat production. Metabolism of brown fat in infants generates heat. Another function is transport. Blood transports. Blood is a connective tissue. It's a liquid connective tissue. It transports oxygen and carbon dioxide and nutrients, and also transports waste. It removes the waste. The connective tissue has got three components. There are cells, there are fibers, and there's a ground substance. So the cells are usually fibroblasts, macrophages, leukocytes, plasma cells, mast cells, and adipocytes. There are three types of fibers: the collagenous fibers, the reticular fibers, and the elastic fibers. And the ground substance is usually glycosaminoglycans, GAG or GAGs, proteoglycans, chondroitin sulfate, and hyaluronic acid. Let's talk a little bit about the cells. The fibroblasts are the main cells. They produce fibers and ground substance, which is called the matrix. And another type of cell is the macrophages. They phagocytose foreign material and activate the immune system. Another type of cells is the white cells or the leukocytes. They react against bacteria, toxins, and other foreign material. There are plasma cells, which synthesize antibodies. There are mast cells, which secrete heparin and also secrete histamine. And histamine causes vasodilatation, and heparin prevents clotting of blood. The adipocytes are the fat cells. The fat cells store fat. And there are some fibers. We said that there are three types of fibers. There is the collagenous fibers, and the collagenous fibers is made of a protein called collagen. The collagenous fibers are tough, flexible, and resist stretching. They are abundant in the tendons, ligament, and the deeper portions of the skin. Reticular fibers are thin collagen fibers. They form a framework for organs such as the spleen and the lymph nodes. And the elastic fibers are thinner than the reticular fibers. They are thin collagenous fibers. They are made of a protein called elastin. Elastic fibers stretch and recoil like a rubber band, and the elastic connective tissue contains elastic fibers and is abundant in the walls of the artery and the airway. So there are different types of connective tissue. There is the fibrous connective tissue, areolar connective tissue, reticular, dense regular, dense irregular, adipose tissue, cartilaginous tissue, bone, and blood. Blood is a connective tissue. So first, let's look at the fibrous connective tissue. Fibrous connective tissue is divided into two broad categories depending on the relative abundance of fibers. So the loose fibrous connective tissue has less fibers and more ground substances. There are two types of loose fibrous connective tissue. You have the areolar tissue and the reticular tissue. And again, there is another type which is the dense fibrous connective tissue. And the feature is that it has got more fibers and less ground substance. So the loose fibrous connective tissue has got less fibers and more ground substance, whereas dense fibrous connective tissue has got more fibers and less ground substance. There are two types of dense fibrous connective tissue, the dense regular and the dense irregular. Discussing the loose fibrous tissue, let's talk about the areolar tissue. So there are two types of loose fibrous connective tissue, areolar tissue, and also there is the reticular tissue. Those are the two types of loose fibrous connective tissue. Areolar tissue possesses all the 6 types of cells: the fibroblasts, macrophages, leukocytes, plasma cells, mast cells, and fat cells. The ground substance is plenty. There is less cells and less fibers. So if you look at the diagram here, you can see that there's a lot of spaces there. So that indicates that there is a lot of ground substance. Now the fibers are mostly collagenous and nearly every epithelium rests on areolar connective tissue. And here in this diagram, which is a microscopic appearance, you can see very few fibers. There's a lot of ground substance which appears as empty spaces. And also there is numerous blood vessels. And areolar tissue is found in almost every part of the body. And as I mentioned earlier, nearly every epithelium rests on a layer of areolar tissue. It's also seen in serous membranes and between muscles. So reticular tissue is a type of loose connective tissue. It consists of a mesh of reticular fibers and fibroblasts. It forms the main supportive framework for lymphatic organs. It is found mainly in the lymph nodes, spleen, thymus, and bone marrow. So the dense connective tissue is of two types. You have the regular and the irregular type. Let's talk about the dense regular connective tissue. It has got two important properties. It is densely packed and densely packed bundles of collagen, and the collagen fibers are parallel to each other, so the fibroblasts nuclei are compressed. These regular dense, regular connective tissue is seen in areas where there is high stress, especially the tendon, which attaches muscles to the bone, and also the ligaments, which holds the bones together. So the dense, irregular connective tissue also has bundles of collagen packed, which is densely packed, but they are randomly arranged. They are not like the dense regular, which is packed, parallel to each other. So here you can see that they are randomly arranged, and they can withstand unpredictable stresses, but not as much as the dense regular connective tissue. It's usually seen in the deeper layers of the skin, where it binds the skin to the underlying muscles, and it's also seen in the capsule around organs. Adipose tissue is what we call the fat. So adipocytes are the fat cells. If you look at the histology, you find that they look like empty cells, as if there is nothing in it. That's the fat cells. So the function of the adipose tissue is it is a main energy reservoir of the body. It provides thermal insulation and also gives a cushioning effect. The brown fat seen in fetuses and hibernating animals are the main source for production of heat. Now, fat is constantly being synthesized and stored, while others are hydrolyzed and released into the circulation. That means fat is constantly recycled, and that prevents stagnation of fat. So cartilage is relatively stiff connective tissue. It's seen in the ears, the external ear, the nose, and also in air passages. It gives shape to these structures and also keeps the air passages open. Cartilage is produced by cells called chondroblast. The chondroblast secretes matrix, and once it secretes matrix, it becomes entrapped in little cavities called lacunae. Once it is enclosed in a lacuna, they are called chondrocytes. The cartilage is avascular, which means that there is no blood supply, and hence if there is an injury to cartilage, it heals very, very slowly. The cartilage is rich in GAGs, glucosaminoglycans, and also has plenty of collagen fibers. So as we said, connective tissue has got three major components: the cells, the fibers, and the ground substance. So the cells are the chondroblasts, which later become the chondrocytes, and the fibers are collagen fibers, and the matrix is composed mainly of glycosaminoglycans, the GAGs. There are three types of cartilage, depending on the type of fibers they have. You have the hyaline cartilage, elastic cartilage, and fibrocartilage. Hyaline cartilage. Under the microscope, you can see a clear, glassy matrix which is stained light pink or light blue. So that's what you see under the microscope, and that's hyaline cartilage. You can see cells which are chondrocytes enclosed in the lacunae, and usually it is covered by a layer of perichondria. Hyaline cartilage is seen in the trachea and the bronchi, and they keep the airway open. They are also seen in the larynx, which moves the vocal cord during speech. They are seen covering the ends of bone, which is known as the cartilage, the articular cartilage, and the articular cartilage makes joint movement much easier. Again, you have the costal cartilage, which connects the ribs to the sternum. Elastic cartilage. The microscopic appearance shows there are cells called chondrocytes, which are enclosed in the lacunae, and the fibers are elastic fibers. Now, the elastic fibers contain a protein called elastin, and in Marfan syndrome, which is a hereditary defect of the elastin fibers, you find these people have hyperextensible joints. So that's the feature of Marfan syndrome. And usually the elastic cartilage is also covered with perichondrium, and they are located in the external ear, epiglottis, and also they provide flexible elastic support. The fibrocartilage, the microscopic appearance is that there are plenty of fibers, which are large bundles of collagen fibers, which are parallel, and there are cells called chondrocytes, which are located in the lacunae, as in all the cartilage. And again, the main difference is that this is not covered by perichondrium. The places where fibrocartilage is present is the intervertebral disc. They are the disc that separates the bones in the vertebral column, and these fibrocartilage are tough, and it can resist compression and absorb the shock. Bone. Bone is connective tissue, and it is osseous tissue, which is composed of hard calcified connective tissue. There are two forms of osseous tissue, spongy bone and compact bone. Spongy bone has got a porous or spongy appearance with lots of spaces, and it's found in the head of femur, usually seen in the head of long bones, for example the femur, and also seen in the middle of flat bones. That is the sternum and the cranial bones. They are the flat bones. But spongy bone is always covered by a layer of compact bone. Now, compact bone is dense calcified tissue with no visible spaces. It forms the external surface of all bones, and spongy bone is covered by a shell of compact bone. That's what you see here. You can see that is the spongy bone seen in the head, covered by compact bone, and here again in the shaft of the long bones, you can see spongy bone, but it's covered by compact bone. So if you look at the microscopic section of bone tissue, you see that there is a central canal. That's the central canal, and it's surrounded by concentric circles of bone. So this is a concentric circles of bone, which is called a lamella. And the blood vessels and nerves travel through the central canal. So bone is deposited around the central canal in concentric circles, and this is called an osteon. So osteon is the functional unit of bone. It consists of the central canal and the surrounding layers of bone, which is called the lamellae. So bone is produced by osteoblasts. The osteoblast produces the matrix, the bone matrix, and they get entrapped in the matrix after they produce the matrix around it. So they are trapped inside, and these spaces where they are trapped is called the lacuna. So once they get trapped, they are called osteocytes. So osteocytes are osteoblasts which gets trapped, and they become trapped inside the lacuna. Now, the lacuna communicate, even though they are trapped, they can communicate with the other bone cells or the osteocytes, and they communicate through delicate channels, and these delicate channels are called canaliculi. And surrounding the bone, there is a tough connective tissue covering, which is known as the periosteum. So far we were talking about solid connective tissue. Now let's talk about blood. Blood is a fluid connective tissue. The primary function of blood is to carry oxygen to the tissue, remove carbon dioxide from the tissue, and also to transport nutrients to the tissue. The blood also has got the three components. It has got the cells, it has got a ground substance, and the ground substance for blood is called plasma. The cells in the blood are erythrocytes, leukocytes, and platelets. And these cells, or the cellular components, are called formed elements. So the erythrocytes are called the red blood cells. They transport carbon dioxide and oxygen. The leukocytes, or the white blood cells, they provide defense against infection and microorganisms. And the third component, which is platelets, are involved in clotting and other mechanisms.